Good afternoon. Thank you for joining us for our quarterly virtual council meeting. I'm Brandy Vinson, Executive Director of Quality Insights Renal Network 5. Before we get started, I would like to go over a few housekeeping items. All lines have been muted. This session will be recorded and posted to our website along with a copy of the slides. Please put your questions in the chat and we will answer as many as time allows at the end of the presentation. We will also post a brief evaluation at the end of the presentation, and I ask that you all complete it to help us improve future meetings. What we hope to accomplish today is providing updates on network goals, celebrating improvements, and that's when I'll recognize a lot of facilities throughout Network 5, share network expectations, key takeaways, and then we'll have time for questions and answers. I always like to start this session off with a reminder about the ESRD conditions for coverage, specifically the standard, the relationship with the ESRD network. So this responsibility falls under the governing body who receives and acts upon recommendations from the ESRD network. And the dialysis facility must cooperate with the ESRD network designated for its geographic region. So that, of course, is Network 5, which is held by Quality Insights Renal Network 5 and covers Virginia, West Virginia, Maryland, and DC. The governing body needs to work in fulfilling the terms of the network's current statement of work, which I'm going to review with you all very shortly. And each facility must participate in ESRD network activities like this one and pursue network goals. Our current statement of work is divided into 3 areas: patient and family engagement, which includes quality improvement activities to include patients in QAPI, work with them in developing life plans, and peer mentoring, as well as ensuring that patients have the right to file grievances with the network, and we work on involuntary discharges. Quality improvement, which is all of our quality improvement activities around hospitalizations, increasing vaccinations, increasing the number of patients moving to home modalities and accessing transplant. And then data is all of the data that is reported in EQRS used for the ESRD Quality Incentive Program. And then we have quality measures here as well, and that's timely submission of the 2728 and 2746. Health equity is integrated into every area of our statement of work. Our statement of work is divided into 12-month performance periods called option periods. Each performance period runs May 1st to April 30th, and our current performance period is known as option 3, which started back on May 1st of 2024 and will continue until April 30th of this year. Throughout this presentation, I will share data from our current option period and show how we're tracking to meet goals by April 30th of 2025. I do want to start off with addressing health equity. As you all may be aware that your facility commitment to health equity, your attestation is due in EQRS by February 28th. This is a requirement of the ESRD Quality Incentive Program. If you have questions or need guidance on how to do this, please contact our health equity specialist, Andrea Moore, and I have provided her email address here. Fresenius and DaVita, your corporate organizations have already batched over those attestations, so no action is required from DaVita and Fresenius clinics. I want to do a quick check-in with everyone on this exact topic. So you should see a question on your screen. Has your facility submitted your commitment to health equity attestation in EQRS? So if you will just give me some feedback here, it would be greatly appreciated. All right, it looks Responses are still coming in, so we'll give it a few more seconds. They're slowing down, so we'll go ahead and end the poll and I'll share the results with you. Good news, 59% of the participants who responded have already submitted their attestation, so that's great news. 9% of you still need to do that, and then 33% don't know, which is understandable. Not everyone in the facility is going to know if this has been taken care of or not. So you might want to check in with your leadership, your facility administrators, especially if you are in an independent unit, so a non-Fresenius or DaVita clinic. Check in to make sure this gets completed by the end of February. All right, we'll do a few more of those throughout the presentation today, so stay on your toes and at your computer so you can participate in our polling questions. Before we dive into network performance, it being late in January, it's the perfect time to remind everyone about emergency preparedness. We've already had several winter weather events this year. The winter storm that took place the first week of January, we had a record number of facilities notifying the network about delays and closures. So thank you so much for doing that. But I do want to remind everyone and encourage you to be proactive with your emergency preparedness. Do not second guess weather events. If your local weather is telling you that winter weather is coming, prepare accordingly. Review your emergency plans prior to the weather events so you're not reacting, and have your local Office of Emergency Management contacts on hand. Don't forget to report delays and closures to the network. What happens here is we get calls and complaints from patients about the communication about delays or closures, and we have not been notified by the facility that these closures and delays have actually happened. So definitely keep us in the loop of your schedule. We often get questions about how to report those closures. So I have a screenshot of our website here along the toolbar at the very top, all the way to the right. Second to the last option is contact us. If you hover over that, a drop down drops down that says report facility closure. You select that and it'll take you directly to the form to report a closure. Okay, now we will get into the progress on network goals and start our recognition of high performers throughout the network. So you might recall that we have two goals related to home, incident and transitions to home. So you've seen these graphs in the past. On the left-hand side is the royal blue line bar, which shows our baseline. The navy blue bars in the middle is progress to date. To date is December 31st of 2024, so our data always lags about 1 month. And then to the right, the gold bar is the goal assigned to Network 5 by CMS. So you can see with incident to home, these are patients who are starting a home modality within the first 90 days of their first day of dialysis. And we are about halfway to where we need to be to reach this goal. You know that we're at the end of January and we need to reach these goals by the end of April. So you can see we're lagging in this area. Of course, the network is aware of the disruption of the PD solution due to the impacts of the Baxter plant in North Carolina. We also communicate those challenges to CMS to make them aware of the slow progress on getting patients started on a home modality. Looking at transitions to home, these are patients who have been on dialysis for longer than 90 days, transitioning to a home modality. And again, we're about halfway to where we need to be at 1,237 patients starting a home modality. So more work to do there. But we do want to recognize the following units who have exceeded both their incident to home and transition to home goals. Alexandria Kidney Center has had 7 incident to home starts and 7 transitions to home. DaVita Puddle Duck has had 9 incident to home starts and 6 transitions to home. This is just in this performance period. So starting May 1st of 2024 to December 31st, 2024. So great work for these facilities, as well as FMC Kanawha, who had 8 incident to home starts and 7 transitions to home. So great work. Please continue to educate your patients about home modalities and get them trained so that they can experience this relief to and improve quality of life. Okay, so time for a pop quiz. So another poll. Okay, on your screen, you should see 2 questions. The first one being, my facility does not have a home program. Do I still have an incident to home goal? The second question being, a patient has to move to a home modality within how many days of their first day of dialysis to be considered incident? Responses are still coming in, so we'll give it a few more seconds. Okay, slowing down. Let's see how you all did. My facility does not have a home program. Do I still have an incident home goal? Yes, 67% of you answered that correctly. All facilities have the option to have the opportunity to move patients to a home modality within those first 90 days. So all facilities have incident to home goals. A patient has to move to a home modality within 90 days of their first day of dialysis to be considered incident. So very happy to see that the majority of you, 85%, answered that correctly as well. Great work with the pop quiz. Okay, moving on to transplant. You'll recall that we have 2 goals related to transplant, adding patients to the transplant waitlist and then patients actually receiving a transplant. So the first one, waitlist, Network 5 historically does a great job with adding patients to the transplant waitlist. You can see our goal is more than 1,300 patients and we are already at over 1,200. So we are well on our way to meeting that goal. Great job to all of you who are contributing to that. Transplants typically lag a little bit more. As I said earlier, our data lags usually 1 month. For transplants, it's usually 2 months. So ideally, we're closer to 1,000 transplants, but we won't see that in the data for a few more months. But our goal is almost 1,500 transplants, and we're on our way and very hopeful that we will meet this goal as well. The following facilities have exceeded their goals for transplants already, and that is FMC Prince William County Dialysis, who has already had 12 transplants this performance period. Largo Peritoneal Dialysis has had 10 transplants. Forest Park Dialysis Center has had 9, and UVA Lynchburg has had 9 transplants as well. Great work. Thank you for your contributions and helping patients receive kidney transplants. All right, we've had a change in our contract as it relates to vaccinations since the last time we met in September. You see, we only have 2 vaccination goals at this time. Both only apply to patients. So pneumococcal, we are on our way to reaching 46.64% of patients being up to date on their pneumococcal vaccines. But this is a tricky one because as soon as a patient reaches the date that they are no longer up to date, we really need facilities to stay on top of that and have someone own vaccinations within the clinic to make sure patients are being vaccinated as soon as they become no longer up to date. With patient influenza, the goal is 80%. We are almost at 74%, so we are on our way, but certainly do not let up on your attempts and work on getting patients vaccinated for influenza. Your new patients, as soon as they start dialysis within your clinics, make sure they have already been vaccinated and you document that, or get them vaccinated in your clinic. Back in September, I showed you how we were doing as a network for pneumococcal vaccines by organization, and the trends continue. Fresenius is a leader amongst pneumococcal vaccinations in our network, and then other providers. The red bar represents DaVita, the purple bar represents ARA, also now known as Innovative Renal, really have an opportunity to make some big improvements in this area. The following facilities have already met their pneumococcal and influenza goals for this performance period, and we appreciate the work being done here by BMA North Roanoke, FKC Kempsville, FKC Indian River, DaVita White Square, and FMC Morgantown. For hospitalizations, we had a contract change here as well since our last call in September. We are now only looking at inpatient admissions and ED visits, so no longer looking at those 30-day readmissions. Remember, with hospitalizations, this is an upper threshold, the gold bar is, and so we're trying to remain below it to achieve this goal, which is we are performing well for both of these measures at this time, but please continue to work with your patients to try to keep them out of the hospital. Side note, remember, we're only looking at specific hospitalizations as they relate to a list of ICD-10 codes provided by CMS. So this isn't all hospitalizations, it's just very specific ICD-10 codes, which you all should have, but also available on our website if you need to reference that list. We have been focused on sepsis awareness, which is the leading cause of hospitalizations in Network 5, and the following facilities have had 0 sepsis admissions so far as compared to last year. So these facilities have had 100% improvement in their sepsis hospitalizations this year. So BMA Russell County, DaVita Berlin Dialysis, DaVita Greater Portsmouth, DaVita Howard County, Franconia Dialysis Center, Good Samaritan Dialysis, that's their main campus, Great Bridge Dialysis Center, and Wood County Dialysis. You might recall that we've had 2 hospitalization campaigns this year. One was Sepsis Awareness Month, and UVA Amherst was the winner of that campaign. This is a picture of their staff with their certificate that they earned from the network, and they had a catered lunch. The second campaign was Vascular Access Week, and U.S. Renal Care Arlington won that campaign and also received a catered lunch from the network. This is a picture of them enjoying that. All right, moving on to patient and family engagement. We still have 3 goals in this area. Patients engaging in QAPI. We have almost reached this goal, but still need to see some improvements here. Patients developing life plans. We have already exceeded that goal, but of course would love to see this grow, as well as peer mentoring. So we have a lot of facilities to recognize here. For life plans, a total of 78 facilities have fully credited toward this goal. I would like to mention that all UVA facilities have met this goal, so congratulations, and we appreciate your dedication to patient and family engagement, specifically around life plans. Newly added to this list in option year 3, as demonstrating processes in place for patients having goals on care plans, are IDF Chestnut Square, U.S. Renal Care Silver Hill, U.S. Renal Care Prince Frederick, DaVita Seat Pleasant, FKC North Salisbury, U.S. Renal Care New Carrollton, Renalis Capital Region, RAI Chesapeake Newport News, Kaiser Tyson's Corner, DaVita Hampton Roads Home Training, FKC Shenandoah Valley, DaVita Southern Tide, FKC Appalachian, and FKC Upshur County. For peer mentoring, we've had 49 facilities credited towards this goal, newly added to the list in option year 3 as having a patient complete mentor training or get paired with an existing mentor include FKC DuPont Circle, FKC South Annapolis, FKC Prince George's County, FKC Middle River, DaVita Annapolis, FKC Merritt Boulevard of Dundalk, Renalis Capital Region, DaVita Edgewood, UVA Kidney Center, FKC Norfolk Tidewater, FKC Richmond South, UVA Zion Crossroads, UVA Orange, UVA Augusta, UVA Page, UVA Farmville, UVA Stanton, and UVA Culpeper. Finally, we have 69 facilities fully credited towards this goal of engaging patients in QAPI, newly added to the list in option year 3 as having a process in place for regular attendance of patients in QAPI include DaVita Newport News, DaVita Forest Hill, UVA Zion Crossroads, and UVA Lynchburg. Thank you to all of you for your commitment to patient and family engagement. Finally, data quality. We continue to have 2 goals in this area, and this is timely submission of the 2728 forms. This is getting forms submitted in EQRS within 45 days of the patient's start of dialysis. We have exceeded this goal at this time, but this is a rolling goal, so make sure you continue to get those forms submitted on time. Cannot stress enough, do not wait until day 44 to get the physician to sign your forms. Looking at the 2746, so this is the death notification forms, need to be entered into EQRS within 14 days. We have also exceeded this goal at this time. We have a lot of facilities doing great with getting their forms in on time, and those facilities are recognized as data stars on our website. Today, I want to recognize 7 facilities who had 15 or more death notification forms due, and all were submitted on time. They also have submitted 100% of their 2728s on time. These facilities have great processes in place and demonstrate that this can be done. BMA Farmville, DaVita Crater Charleston, Liberty Dialysis South Hill, FMC Princess Anne, DaVita Bel Air Dialysis, DaVita Puddle Duck Dialysis, and Artificial Kidney Center of Suffolk. I do want to put in a plug for the annual CMS 2744. So this is your annual survey, the reconciliation of patients for a calendar year. These need to be generated by Friday, January 31st. So that's this Friday in just 2 days, and submitted by Monday, March 31st of 2025. Absolutely contact Allison Crittenden if you need help here at the network. You can see her email address and phone and extension here on the slide. Please note that Fresenius clinics do not need to worry about this. Your corporate entity takes care of this survey for you. Everyone else needs to take action. We have received a request from our partners at the state survey agencies to make our providers aware that during routine recertification surveys, several ESRD facilities were cited for not properly inserting the tubing beneath the venous drip chamber into the venous line clamp and optical detector during the pre-dialysis testing process. Additional instances were noted where the optical detector door was left open. This is a patient safety concern. It is essential that the door is securely closed and the tubing is correctly positioned in the venous line clamp and optical detector during pre-dialysis testing. These steps allow the dialysis machine to accurately monitor the blood flow returning to the patient. Failing to securely close the door may allow air to enter the bloodline, leading to false blood flow readings, and not inserting the tubing correctly beneath the venous drip chamber can introduce air into the patient's bloodstream, potentially causing an air embolism. To avoid citations and ensure patient safety, make sure you are following the operator's manual carefully. All right, as we get closer to the end of this presentation, I always like to review network expectations. These typically do not change, but we like to be very transparent with you about what we expect. Number one is to engage with us, respond to inquiries and requests for information, take action when needed, and sign up and read our electronic newsletter alerts. You can do that on our website. That is absolutely the best way to keep in touch and know what the network is working on. Notify the network of major events. We've reviewed this already. That's facility emergencies and closures, and then changes in leadership and staff. Inform patients of available resources that are provided by the network, like the grievance resolution and educational materials that are available on our website, as well as information about joining our patient and family advisory committee. Lastly, pursue network goals. Participate in our quality improvement activities, engage in network facilitated technical assistance, and absolutely every single month, monitor your progress on reaching network goals by utilizing the ESRD facility report, and then discuss and document those discussions in your QAPI meeting minutes. The ESRD facility report was just updated and is available with December data, and those notifications went out to administrators, medical directors, and social workers on Monday of earlier this week. If you ever need help with accessing your ESRD facility report or have questions about the measures or the data, please do not hesitate to contact me, and I'm happy to walk you through it. Okay, time for another check-in. This is an easy one. Let's see. Okay, you should see the question on your screen. My facility discusses network goals during every QAPI meeting. Okay. Yes, the majority of you are discussing goals during every QAPI meeting. So that is great news. That's 84%, 11% have some work to do, and then 5% aren't sure. If you don't attend QAPI meetings, then you may not know. However, leadership should be really sharing network goals and discussing that with all staff in daily huddles and things like that. So improvement to do with some of the participants, but happy to see that the majority of you are doing that. Okay, we will move on. Finally, the key takeaways from today's presentation are that all facilities are required to be working towards all of the network goals. Individual projects may focus on a few specific goals, but this does not disqualify a facility from making progress on the others, and engage with the network. The conditions for coverage require it. If you need help or assistance or have questions, please do not hesitate to contact the staff at Network 5. We are all listed here with email addresses. Call the main line up here, and then extensions are over here on the right. Please note our patient services line is extension 2704, and if you need to email about patient services, please do so at the network5@qualityinsights.org web address, but please do not include patient names that cannot be emailed, so you need to call us or fax information pertaining directly to patients. Thank you so much for joining us today, and I am happy to take questions. You can drop those in the chat. I am going to have, yes, there we go. Amanda dropped the evaluation link in the chat, and once you disconnect from the meeting, it will also pop up. And so I do appreciate you filling that out and providing some feedback. We do have a question about how do we generate the 2744. You do that in EQRS. If you need help with that, please contact Allison Crittenden, and she can definitely help you. Not sure what you all are seeing now. I was going to go back to the slide with Allison's contact information. All right, any other questions? Okay, then that will conclude today's presentation. I appreciate you all taking the time to join us today. Do not hesitate to reach out if you need assistance. Thank you. Bye-bye.